My earliest memory of the impacts of bias towards immigrant communities comes from the third or fourth grade when I was attending a bilingual dual immersion school in a coastal California farming community. At the school, most of my classmates and friends were from Mexican and Central American migrant families. One afternoon at school, a school liaison came to our classroom to hand out a resource letter for the migrant students. As these letters were being handed out to the addressed students, I noticed my friend next to me put his head down, shudder, and then refused to accept the handout, saying, "That's not for me. That's not me." I didn't understand his reaction, or why he didn't want to bring the letter home. Of course, as a third or fourth grader, I wasn't yet familiar with the concepts of racial bias or systemic oppression, but I knew there was something strange going on when my friend rejected his immigrant identity and his family identity. I can see now that he internalized societal messages of stigma and bias about immigrants, and as a result, he didn't want to accept this help. I've spent the last decade as a child clinical psychologist, and while I'm no longer that kid in the classroom, I clearly carry these experiences with me. As a white male born in the United States, I'm an outsider to the immigrant experience, but I believe there's a role that I and others like me can play. So much of my work focuses on immigrant kids and families. I offer trauma-focused clinical care in local service programs, and I've also met with newcomer kids and families at the border and in immigration custody as part of advocacy efforts to protect their rights to health and safety. Through this work, I've become intimately familiar with immigrant families' strengths, resilience, and substantial contributions to society. But unfortunately, I've also been made astutely aware of the harms they have endured, oftentimes as a direct result of our national systems and policies. As a child, I always felt warmly welcomed into Latin American culture and traditions through the sharing of food, music, and holiday celebrations. So it's been especially difficult and appalling for me to see the ways in which this welcome has not been returned. Whether it be at the southern border, where children have been forcibly separated from their families and detained, or sent back into dangerous countries and border towns, or whether it be the doorsteps of our service systems, where newcomer children often struggle to find clinicians or educators who speak their language and understand their context. This is especially concerning as we see record numbers of children and families seeking safety as they flee from home countries that are stricken with extreme poverty, violence, and social conditions that make it impossible to thrive and to grow. In 2022, there were over 150,000 children that arrived at our southern border unaccompanied, and hundreds of thousands more that arrived with their families. As a trauma psychologist, I'm all too familiar with the significant risks associated with accumulating unaddressed childhood trauma, from increased anxiety, depression, and PTSD, to physical manifestations such as high blood pressure, stroke, and heart attacks, and all the related functional impairments. If left unaddressed, stigma and trauma can shape a child's entire identity and their future. But all children deserve the chance to be true to themselves and to thrive. Unfortunately, our immigration system is not designed or equipped to protect the increasing numbers of children and families that seek safety here. Our immigration policies have advanced deterrence-based practices that harm these kids. Yet so many children do ultimately make it into our US and our California communities. California is one of the top 4 states receiving newcomer children, where about 1 in every 10 newcomer kids that enter this country settle in our state. But they arrive with no real safety net or program of care to support them. These are our neighbors. These are your kids' classmates. All too often, newcomer immigrant children struggle to access resources and understand our systems. To demonstrate, let's consider a common storyline. Carlos is a 15-year-old boy who fled his grandparents' home in El Salvador after he witnessed the violent murder of his uncle by gang members. His grandparents clearly feared for the boy's safety, as did his mother, who had immigrated to California when Carlos was just 5 years old. She urged her son to come and join her. Driven to reconnect with his mom and eager to apply the electrician skills his grandfather had taught him, Carlos set out to build a new and safer life. He survived an arduous journey to the border, riding for days in the back of a refrigerated truck where he saw others around him get sick and some perished. After arriving at the border, Carlos was detained on a military base for 2 months, where he slept in a large tent with hundreds of other boys, spending 23 hours a day indoors, before finally being cleared for release to his mom. After arriving in the Bay Area, he enrolled in school where he felt nervous in his new surroundings and was overwhelmed by the unfamiliar subject matter being taught in English, a language that he was just beginning to learn and to practice. Through school, he was connected with the asylum legal services that could possibly secure his safety and stability in the United States, but he wasn't ready to talk to anyone about his trauma. He had been experiencing flashbacks and nightmares that were too stressful and overwhelming for him. He was also given a phone number for a mental health service program, but he just didn't know what to say in a phone call, so he never picked up that phone. Over time, his school attendance began to decline, and he began to wander the streets looking for casual work. Conflict at home began to escalate as his mom was receiving calls from the school about his absences. Carlos began to seriously question what his future was going to be like. In Carlos's story, we see a promising teen who was overwhelmed by his new environment, whose experience of post-traumatic stress went unaddressed, and who fell through the cracks of our systems. Along with colleagues in the School of Medicine, I'm working to address these problems through the development and evaluation of service programs and systems that are multidisciplinary, comprehensive, and trauma-informed in their design. We are building towards systems that provide a warm welcome. We envision programs of care that are tailored specifically for immigrant children and are designed to address their legal, medical, mental health, educational, and social needs in an integrated and coordinated fashion. With these programs, we can create a different ending to Carlos' story. Imagine that at school, Carlos steps into a newcomer support group where he's connected with peers who have similar experiences and where he learns and shares about the impacts of migration-related stress. Imagine that Carlos is introduced to a system navigator, also Salvadorian, who helps introduce and connect him to available resources in his community. Imagine that Carlos and his mom begin to work with a therapist who's trained to address immigration trauma, to help them understand one another's experiences, and to help Carlos learn ways to manage and process his post-traumatic stress, helping him prepare for his conversation with the asylum lawyers. Imagine that Carlos's various support providers are communicating and coordinating to identify and address Carlos's priority needs, preventing him from having to repeatedly retell his story to so many new and different people. Some of these best practice examples come from great work that is being done by grassroots, community-based organizations. And we're partnering with local organizations such as Ayudando Latinos a Soñar in Half Moon Bay and Catholic Charities in Santa Clara County to support their efforts. But these groups are so busy responding to frontline community needs, they often don't have the bandwidth for 3 key steps that are important for moving this work forward. We must first share out best practices in trauma-informed care for immigrant kids. Second, design strategic program innovations, stepping back and dreaming big. And third, evaluate the data to show the full impacts of these efforts. Program design, strategy, and evaluation are key to informing larger shifts in policy and systems. Together with our partners and collaborators, we can advance local and national systems that truly protect immigrant children's safety, health, and best interests. We build towards systems that promote peer, community, and cultural supports, and that align with immigrant child and family priorities in navigating the challenges and adversities that they face. Creating systems of care that are welcoming, culturally informed, and designed for and by these immigrant communities, we can help to counter the stigma that I saw impacting my elementary school friends. Together, we can change the narrative for these children. I invite you to join me, my colleagues, and our community partners in this effort, and help Carlos and the other kids like him grow up into healthy, thriving adults. Thank you.